Okay, everybody, I have just about 1 o'clock. We're going to go ahead and get started. And today's presentation is on auxiliary grants. And we have on the line with us Tashawn Harris from the Adult Protection Services Unit at DARS. And in just a couple minutes, I'm going to turn it over to her. And she's going to go through the PowerPoint that I sent out to all the participants yesterday. And then she'll take some time at the end to answer any questions that you may have. Before I turn it over to Tashawn, though, I just have a couple of announcements. One is that this training is going to be recorded and archived for the benefit of those who couldn't join us today. What I'm going to do after the training is put this up on YouTube, and I'll send the link out to everybody. That way you can listen to this later if you want to, or else share it with maybe a colleague that wasn't able to attend today. And we have both WISAs and VR staff on the line, so I have a couple announcements for each of you. First, for the WISAs on the line, those of you who have received your full credentials through Cornell and need your 60 hours of continuing education credits, you can count your participation in the webinar today as part of those credits. I worked out a deal with Ray Sabula where you can log in your time that you spend on any of the webinars that I do in your continuing education portal. So what you would do is just put in today's date when you log into your portal, the name of the session, which is Auxiliary Grants, my name. The length of the session will be about an hour. If you have any questions about how to access your portal or how to log in your credits, please email Ray Sabula's assistant, Michelle Alvord. She can be reached at msa224@cornell.edu, and she can walk you through the process of logging in those credits if you need to. For the VR staff on the line, there are CRCs available for your participation today. So if that's something that you require, send me an email after the training at Michael, M-I-C-H-A-E-L, .klinger, K-L-I-N-G-R, at dars.virginia.gov, and I'll make sure that those credits get logged in for you. Okay, and that was it for my announcements. With that, I'm going to turn it over to Tashawn to start her auxiliary grant PowerPoint, and just bear with me for a minute while I make her the presenter.
All right. Did everybody hear what I said the last time?
Okay, Tashawn, we didn't catch the first part of that, so can you repeat that, please?
Okay, then. Can you hear me now?
Yes, go ahead.
Okay. Okay. I'm sorry. My first time doing a webinar. Okay. Basically, I wanted to explain to each of you about the auxiliary grant program. In our first slide, I'm talking about the auxiliary grant and the Social Security Income Connection. SSI, which is a federal program, was established in 1972, and it replaced the old age assistance aid to the permanently and totally disabled, and aid to the blind. When they replace those programs, the SSI benefit was paid at a lower rate. Therefore, the Social Security Administration asked that states create a mandatory state supplement for the SSI program. So Virginia calls its state supplement the auxiliary grant. So basically, what is an auxiliary grant? It is a state supplement for individuals receiving SSI and certain other age, blind, or disabled individuals who live in a licensed assisted living facility or an adult foster care home. Now, the licensed assisted living facility has to be licensed by the Department of Social Services, and the adult foster care home is a local approved agency. So the local DSS approves adult foster care homes. The payment is made by the local Department of Social Services directly to the individual or his payee. And basically, AG funding is 80% general funds and with a 20% match. The AG rate is generally set by the General Assembly, which is currently $12.19 per month. And in Planning District 8 in Northern Virginia, there's a 15% differential, and that rate is $1,402. The AG payment is comprised of two parts, a payment to the adult to be used to reimburse the facility for care, and then the personal needs allowance. Okay, the personal needs allowance is used for the resident for such things as over-the-counter drugs, extra snacks, tobacco products, clothing, medical co-payments, prescriptions not covered by Medicaid, dental care, eyeglasses, provisions for personal telephone and long-distance service, transportation, and activities outside of what is offered by the assisted living facility or adult foster care. So that $82 has to go a long way, and we know that that's primarily not enough in today's economy. Now, the levels of care. When a person is assessed to live in an assisted living facility, they are either determined to either be residential living of care or assisted living level of care. Now, with the residential living, the UAI, which is the Uniform Assessment Instrument, that's usually done by the local Department of Social Services, or it could be done by a community service board or another approved provider to do assessments, like the SILS or aging can do also a UAI. But for residential living, they have to be rated dependent in one of the 7 activities of daily living, or rated rated dependent in one or more of the 4 selected instrumentals of activities of daily living, and or dependent in medication administration. And for the assisted living level of care, they're rated in 2 or more of the 7 ADLs, or they could be rated in behavior patterns such as being aggressive. What is generally covered under the auxiliary grant? Primarily room and board, and maintenance and care. I'm not going to read all that to you. Medication, provision of general toiletries such as soap and toilet paper, assistance with care of personal possessions. If the facility or if the resident asks for it, they could also provide care of their personal needs allowance. They may assist them in managing their money. But of course, they have to obtain permission from the resident to do so. Also, securing health care and transportation and providing social and recreational activities required by licensing regulations and general supervision and safety. So how is the eligibility determined? A person has to be 65 or older, be blind or disabled. They must reside either in an assisted living facility or an adult foster care home. They have to be a citizen of the U.S. or at least meet alien-specific criteria. They have to have non-exempted countable income, and they must have less than $2,000 in resources for one person or $3,000 for a couple. And they have to be assessed with the UAI, and they must reside in Virginia voluntarily for 90 days. And that was something added new in 2012. So basically, when a person is applying for the auxiliary grant, they go to their local Department of Social Services in the jurisdiction where they live. So if they are from Henrico County, they would go to Henrico DSS, and they would use an application for benefits. I know right now that there's a lot of confusion with the new systems that local Department of Social Services are using, but we still, with the auxiliary grant program, have not been automated. We still use the paper process. Okay. The individual also must contact their local Department of Social Services for the assessment in the adult service unit. So someone will come out to their home prior to their placement in an ALF to assess to see which level of care they qualify for. Now, clients will receive the AG check directly to them, and they are a responsible person to make the payment to the facility. Or if they have a guardian, then that person will be given the check to pay on that person's behalf. And then also the facility that they choose to live in must be an AG provider with the state. So that facility has to sign an agreement with the state that they are willing to accept the 1219 rate. Basically, if the AG rate is below the private pay rate for the facility may not charge the resident or the resident's family or reasonable party for the difference. And an ALF may not collect any money over and above the AG amount that has been approved by the local Department of Social Services for that individual. There are times that the AG check can be cut off, for the lack of a better word, and that is when they're no longer found eligible. If they're no longer in the facility, they enter into a state mental health institution, they're in jail or incarcerated, or if they become income ineligible because of over the income limits or the resource limits, or they no longer meet the assisted living level of care criteria, meaning that they no longer meet the need for being in an assisted living facility. Maybe their health has declined that they really belong into a nursing home. So basically, the auxiliary grant, with proper notification to the eligibility worker in these circumstances, they will work towards discharging them from the program. Also in 2012, we had a third-party payment provision added to the regulation. And this allowed for individuals who had some means, either through family or a neighbor or an organization, who wanted to contribute to the care of the residents, because like I said, the $82 not all the time is enough to cover all their personal needs, and someone may want to assist them in acquiring some additional goods or services. For instance, like if a person who use adult diapers, and they can be very costly for the facility, so they may try to offset the cost by having someone to do a third-party payment. The third-party payment cannot be used towards room and board. If they use it towards room and board, then that will constitute the individual having to have income counted, whereas if they use it for other goods and services, that would not be counted against them. And of course, you know, it has to be a voluntary payment, you know, by the third party, in order to that they don't feel like they're forced, or it being contingent upon the person's admission. Okay, we also had some new legislation that became effective July 1st, and this is a new setting for the auxiliary grant program. We have a work group now trying to develop the policies and procedures and to update the regulations in regards to this new setting. So House Bill 675, the delegate piece proposed to the General Assembly, allowed for the auxiliary grant to be used in support of housing. It has a 60-person cap, and of course there has to be a provider agreement signed with the Department of Behavioral Health, and they also have to be a licensed provider with behavioral health. And then the individual who wants to step down into a supportive housing program has to have already been an AG approved person already living in an assisted living facility or adult foster care. Okay, and now I'm open for questions.
It looks like we do have one in the chat box. Terry Nunley asks, what happens when an individual goes to work and begins earning income?
Okay, when a person goes to work, their income will be counted in terms of the auxiliary grant program, because the grant actually supplements their income. So if they're making a certain amount of money, it will reduce the grant amount.
Okay, and Jonathan May also has a question. If a client has a payee who is not in the ALF, is the auxiliary grant payment issued to the ALF or the payee?
You would have to advise the eligibility worker, if this person has a payee, the address as to where the auxiliary grant should be sent to. If not, it will go to the client at the ALF.
Okay, thank you.
It would be also the payee's responsibility if it goes to them and they have the authorization to sign or cash the check to make sure they make the payment on behalf of the client.
Okay, does anybody else have a question? If so, type it into the chat box, please. Okay, Nathaniel has one. Is the AG available to those living independently in the community?
No, they have to meet the auxiliary grant requirements. They have to be age, blind, disabled. Their income has to be low enough that it's lower than the threshold of the 1219 rate, and they have to have resources that are $2,000 or less.
Okay, it looks like we have a couple more questions. So Nathaniel's follow-up to that is, so people must survive on $733 per month in Virginia.
Okay. If they don't meet the age, blind, and disabled, but if they're receiving SSI 733, then they would, and they want to live in an assisted living facility, then they would apply for the auxiliary grant.
Okay, so we have two questions that are kind of related, so I'll read them both, and then you can answer it as you see fit. So Terry Nunley has a follow-up. Is there an income limit or point at which the grant would be reduced? For example, if the client is earning $300 per month working, would their grant be reduced by $300 and they have to pay the facility for room and board? And then Jonathan asks, can you give a more detailed information about how income affects the AG?
Okay. So basically, the rate is $12.19, and we also give the individual $82. So when you add that up, the AG need is $13.01. Okay. With that, we also look at their individual's income. What money do they already have? If they only have SSI, which is 733, you would subtract 733 from the 1301, and that would be the person's auxiliary grant supplement with the personal needs allowance, which is $568. So if the person's income is greater than the $12.19, then they will not be eligible for, or greater than the $13.01, excuse me, they will not be eligible for the auxiliary grant because there's no need, their income doesn't need to be supplemented because the threshold is the $13.01 need. But if, say, they had an income of $733 and maybe their income from their job is $200 a month, which would give you, say, $933. That $933 will still be subtracted from that $13.01, and that means that their auxiliary grant supplement will only be $368. So in essence, your income does impact your AG. I guess the more money you make, the less AG you receive. And I think, Jeremy, can you repeat the other question? I'm not sure if I addressed that one. I know you read both of them at the same time.
Yeah, so there was one more that Milton asked, and I think you might have addressed that in your last answer. So when an individual has earned income and the AG grant is reduced, does the AG grant calculation use the full SSI benefit amount, in other words, 733, or the reduced SSI based on the income when calculated in the grant amount received?
Okay.
Touched on that.
The SSI amount is counted, whatever the person, that's why it's important that they report their income to Social Security Administration, because if they're on SSI, they would make the adjustments for us. So we would just based on whatever that amount is. But say if they weren't receiving, say if 733 was SSA money and $200 was work-related money, and that means they're non-SSI, then we would look at that 933. There's a $20 disregard with that, and so we will actually be counting 913 as their income and subtracting that from the need of 1301. So if they're SSI, most of the times they have reported what their extra income is, and SSI makes an adjustment, and then we will base their countable income on that. But if they're like non-SSI and they turn in pay stubs and have other types of retirement income or some other type of income, then we count that as their countable income.
Okay, thank you. And Jonathan May has a follow-up question as well. So can the ALF require items to be provided that would be considered a third-party payment? So, for example, if the client needs additional adult diapers, which would be considered maintenance and care, can the ALF limit the number of adult diapers that they will provide?
They may limit the number of diapers that they may provide, because I think in the regulations there is this caveat of making a determination, somebody making a determination of just the bare minimum in terms of, like, I think they use the word occasional use. So anything that is not occasional use of diapers, they may consider that to be more excessive and therefore charge additional monies to meet that need. But of course, they need to document that need in that individual service plan. They need to have some kind of indicator that this person is incontinent and that there is a need. They just can't arbitrarily just say this person needs to have more diapers, or they don't have an issue, with incontinence or anything. So the need kind of has to match the demand, and it has to be kind of documented.
Okay, just a couple more questions. A follow-up to that is the AG calculated monthly or quarterly?
It's calculated monthly.
Okay. And then Terry Nunley asks, how do we know if an individual is receiving the grant? Sometimes individuals I work with do not always know what benefits they're getting.
Okay. Yeah, that is a good question. More than likely, you would probably need to find, more than likely, if they're going to be placed if they're applying for the auxiliary grant, they more than likely are being placed in an assisted living facility or an adult foster care home. So there's someone who has made that placement, family member, social worker, CSB worker. So that might be your starting point, because you just don't arbitrarily get AG without being in one of those settings.
Okay. If anybody else has a question, please type it into the chat box. Okay, I'm not seeing any additional questions. Anybody have any last questions, concerns, or comments? Alrighty, in that case, we can end for today. Sean, thank you for being with us and for going through the PowerPoint. I appreciate your time.
Thank you. And if they have any additional questions afterwards, or if they run across anything during their casework or whatever, they can always contact me. My contact information is on the PowerPoint.
Okay, great. Thank you for your time and participation today, everybody. Have a great rest of the day. And I will stop the recording now and get this up on YouTube so you can go back and listen to the archive later if you want to. Bye-bye.